Good afternoon, dearest viewers, and welcome to another Facebook Live session here at KL Fertility Center. My name is Moraine, and with me today is Dr. Agilan, who is a fertility specialist here at KL Fertility Center. Dr. Agilan.
Hello, hi. Hi, Moraine.
So glad to have this opportunity to talk to you.
Yeah, nice to see you here.
Could you perhaps briefly introduce yourself?
Okay, as Moraine said, my name is Agilan. I'm a gynecologist and a fertility specialist. I've been in this field for more than 10 years, trying to help couples to give them what they want. They want a baby. Yeah.
Okay, thank you very much, Doctor. Before we dive into the topic of today, I'd actually just like to remind our viewers that should you have any questions, concerns, or whatsoever, all you have to do is just pop them into the comment box below, and Dr. Agilan will be more than happy to address them during this Facebook Live. Moreover, should you feel shy and not be willing to pop a comment into the comment box, you can also send us a private message on our Facebook page, KL Fertility Center. And without further ado, let's dive into the topic of today, which is overcoming infertility in endometriosis. Dr. Agilan, could you please explain what endometriosis actually is?
Okay. Now, endometriosis is when, okay, let's put it this way. A woman has a period every month, right? And the blood that flows out actually comes from the womb lining. Okay, endometriosis is a condition where the tissues resembling the womb lining are present outside the womb. That's endometriosis. So it can be on the ovary, it can be on the woman's fallopian tubes, or it can be on the bowel, or just at surrounding structures around the womb. That's endometriosis.
So it's in a place where it's not supposed
to be. It's not supposed to be, exactly, yeah.
Okay. And endometriosis, is there any specific cause for it?
Okay, well, so far we don't know what is the real cause or how women actually gets endometriosis. Okay, it's not been proven how we got it, but the theory is during the period flow, some of the endometrial lining, the tissues, they flow backward. Now let me just show this here. Show you this. Right, this is the uterus. Okay, this is the uterus lining. So period flows this way out. Yeah, this is the vagina. Now we think some of the uterus lining cells, they flow backward through the tubes, and then they get themselves implanted outside the uterus, and over time they grow. So when the woman have period every month and the bleeding happens, the tissues which are outside the womb, they bleed too. That's why they have a lot of pain. Yeah.
And thinking of endometriosis, what are typical symptoms that women have when they have endometriosis? Okay,
so when you talk about symptoms of endometriosis, a very typical symptoms is period pain. Very severe period pain, don't take it lightly.
Okay.
Okay, because a lot of people say, this is also brings me to one of the myths of endometriosis, where period pain is normal for the woman. Especially when the young girl says that I have severe period cramps or period pain, the mom or the auntie or relatives will say that that's normal, you'll be fine later, but actually it's not. That's one of the early signs of endometriosis. The other typical symptoms will be when the woman has pain during sexual intercourse. Okay, that's a very typical, or sometimes this is the first presentation to a gynecologist. They complain of a pain during sexual activity, and later we find out that they have endometriosis. So these are the two main symptoms of endometriosis. Yeah.
So severe pain during
pain basically is pain
during sexual intercourse.
Sometimes there is no pain. A woman with severe endometriosis, we diagnose that through a laparoscopic surgery. She may have severe grade endometriosis, but she don't complain of period pain at all. So basically the pain doesn't correlate with the severity.
Okay.
Yeah.
Yeah. So pain doesn't correlate with severity. And if you have endometriosis, is there any cure for this disorder?
It's a very good question, and it's a very, everybody will ask this question, can I cure endometriosis? Unfortunately, it's very difficult to cure endometriosis because we only can cure, either medically or through a surgery, endometriosis that we can see, especially during a laparoscopy. Now there's something called microscopic endometriosis spots, which you can't see by naked eye. So we can't cure them because we don't see them. So if you ask me, the answer is probably not, but we can reduce the severity of endometriosis to the level where the symptoms, especially pain symptoms, are reduced.
Okay.
Yeah.
And an often heard statement is that hormonal treatment can, for instance, actually cure endometriosis. Is this actually true?
Well, it's not exactly true. Hormonal treatment doesn't completely cure endometriosis. What it does is it suppresses the severity of endometriosis. For example, if the woman complains of severe period pains, hormonal treatment, either contraceptive pills or sometimes painkillers, it reduces the severity so much so the pain is reduced and she can carry on with her daily activity. It doesn't really take away the endometriosis. Endometriosis will be there. Okay. That means if she stops taking the pills, it's going to come back again.
It's going to come back again. Okay. And is endometriosis, is this linked to a certain age group?
Yeah, that's okay. We used to think that endometriosis comes in an older woman. That's because before laparoscopy was introduced in before 1970s, most of the time endometriosis are diagnosed based on the patient's symptom, and a confirmatory diagnosis is only done when the woman goes through a surgery. And those days before laparoscopy, they need a cut, a cesarean type cut, or even bigger cut, 10 to 15 centimeter of a cut. And not everybody will go through that, especially not a young woman, right? So those who's gone through the surgery in a very severe cases, they are well into their late 30s or even into their 40s. So endometriosis used to be diagnosed in the older woman. Now with endometriosis, with the laparoscopies coming in after 1970s, younger women are getting diagnosed with endometriosis, and we think that it's always been there. It's just that we never picked it up before, because in a laparoscopy there is no big cut, it's just small holes. So even a woman in their 20s, they don't mind going through a surgery, and then gynecologists are diagnosing endometriosis. So the answer is there is no age limit or age bracket where endometriosis happens. It can happen at any age.
Okay, so no age limit.
No age limit, yes.
Endometriosis. Okay, then an interesting question, of course, is how does endometriosis actually impact fertility?
Okay, well, it can impact in many ways. Okay, the first thing is it affects the way the tube functions. It affects the way the ovary functions. Now, if a woman trying to get pregnant, what are the basic processes that should happen? She should ovulate properly, and the egg that had been ovulated should be picked up by her fallopian tubes and brought into the tube. That's where the egg has a chance to meet the sperm, and embryos are formed, and then things happen after that. Then there's implantation and she gets pregnant. Now, if any of these processes are affected, that's how it affects her fertility. First of all, endometriosis that affects the ovary, what it does is it forms a cyst, or known as a chocolate cyst or blood cyst. Now, the cyst actually reduces the egg number. So sometimes it affects the way that she ovulates. Now, if she don't ovulate properly, there is no ovulation, there's no way that she's going to get pregnant. Okay. Number two, if it affects the tube, the fallopian tube, due to scarring processes. Remember in the beginning I said that endometriosis causes bleeding? Yeah. When she bleeds every month, that tissues heal. Just like when we have, or any tissues in our body, when we have an injury, during the healing process we see scarring, right? Yeah. That exactly happens inside the abdomen. When she has a bleeding, there is scarring, so that happens over the years. And that scarring actually can block the tube. Okay. When it blocks the tube, even though she ovulates regularly, the ovulated eggs are not being picked up by the tube. So there is already a big gate there blocking the egg from meeting the sperm. So that's how it affects the fertility. Of course, the third method how it can affect is endometriosis also affects the uterus lining. This is known as adenomyosis. There's a different term for it. Basically, it's just an extension of endometriosis. It affects the uterus, how the uterus function, how the uterus lining function to accept the embryo. So it doesn't function properly, then the chances of the embryo to implant on the uterus are lower, and that also affects a woman's fertility. Okay.
So in basic, it prevents the female egg from meeting.
It prevents the basic steps that should happen for a normal pregnancy to carry on.
We actually got a live question coming in.
Yeah, sure.
Are there any natural ways to reduce or shrink endometriosis?
Okay, right. This question come about because there is a link between the activity of endometriosis with the level of estrogen in the body. Because endometriosis follows the period, and estrogen goes up and down in a period cycle. So the idea is the higher the estrogen, probably the endometriosis severity is more.
Okay.
So people tend to reduce the estrogen level, meaning they take a low estrogen diet. They do things to reduce the estrogen level in the body, try to shrink the endometriosis. Now people have done that. So I'm not a nutritionist. I'm not the best person to talk about the low estrogen diet, but as far as I know, there is no clear evidence to say that if the woman can follow certain diet, for example, it can reduce the endometriosis.
Okay.
Of course, the nutrition will have a different opinion on it.
Yeah.
But as a gynecologist, we don't typically advise them to go on a certain diet. First of all, it's not easy. If I tell you don't eat meat, it doesn't go well with everyone, right?
Yeah.
Because that's one of the things they will say, don't eat meat because it's contain estrogen. Yeah. So natural way, if you ask me, there is none proven.
Okay.
The best way is get yourself properly diagnosed. If you diagnose early, probably you can prevent the after effects of the endometriosis.
Okay.
Yeah.
So indeed, we see that there's no real diet to follow, which has proven.
Yeah, which has been proven.
endometriosis.
Yeah.
Question coming in. Does endometriosis always come with period pain?
Not necessarily. Not necessarily. Sometimes the woman has no period pain, and then she comes in, for example, for a fertility assessment, and a gynecologist picks up that she has a cyst in the ovary. She goes to a surgery, and it's been confirmed it's endometriosis cyst. So that means she has endometriosis, severe enough to give her a cyst, but there is no period pain. As I mentioned earlier, the pain doesn't correlate with the disease activity.
Okay.
But most of the women, pain is the first symptom. So sometimes I would say that maybe they're lucky, or inverted, lucky because when you have pain, you'll go and see a doctor, right? If you don't have a pain, you'll never go and see a doctor.
Yeah.
So when they have a pain very early, probably their chances of getting diagnosed very much earlier in their life is good. So at least we can take steps to prevent the what you call negative effects of endometriosis. Yeah.
Okay, so diagnosis is very
Diagnosis
important?
is the key. Diagnosis is the key.
Okay.
Yeah, because recently, probably about a year or two ago, there is a big research in Europe. They've gone through few European countries and they looked into, are they diagnosing endometriosis early enough? Surprisingly, even in developed countries, there can be a delay between 4 to 7 or even 8 years before they diagnose endometriosis. Because I say people take lightly the period pain, or if the woman has no cysts, endometriosis are just small spots which are not picked up by an ultrasound scan. There is no way a naked eye can see, or ultrasound scan can see an endometriosis spot. They only get diagnosed when they go to a laparoscopic surgery. Now, how many people go to a laparoscopic surgery without clear symptoms, without a cyst? Not that many.
Okay.
Yeah.
Yeah, and we discussed earlier, we discussed about, hey, how does endometriosis impact fertility? There's a clear link between both, but what percentage of the women that have endometriosis are actually able to get pregnant?
Well, we don't have a clear answer, but we believe that at least 60 to 70% of women who has endometriosis, they can get pregnant. It depends on their severity and which structures the endometriosis have affected, which reproductive organs, yeah? But among the women who seek fertility treatment, up to at least about 25 to 40% of those women being diagnosed with endometriosis, varying degrees of endometriosis. So among women who have difficulty in getting pregnant, I would say at least half of them may have an endometriosis. Now, we are not talking about the silent endometriosis or the microscopic endometriosis that I said earlier. Yeah. Interestingly, in one of the fertility conference that I went to, there is an American gynecologist who told us that he diagnosed silent endometriosis during a laparoscopy. So when they put in a laparoscopy, a telescope into the abdomen, everything looks normal. But they injected certain dye, and then actually they can see the endometriotic spots. That means they are either very deep-seated endometriosis, or they are just at the beginning stage. So when they are able to treat all those, that woman's chance to get pregnant improves. So you're talking about natural pregnancy. Yeah.
So in terms of treatment options, what treatment options are available to actually improve your fertility chances?
Okay. Now, treatment options, you're talking about fertility. First thing, the aim of any treatment is going to be to reduce the severity level of the endometriosis. That's the first aim. Now, how are we going to do it? Sometimes if the woman has no cyst, for example, she don't need laparoscopy in the first instance.
Okay.
Then we'll start with some medical treatments. Okay. Some of them will go through basic assessment. Some of them needs an IVF. And once the embryos are generated, we start them on some hormonal treatment, try to suppress the level of endometriosis before transferring back the embryo into her uterus. That typically improves the woman's chance to get pregnant. Now, let's say the woman has a cyst. Now, she typically goes through a laparoscopic surgery.
Yeah.
Okay. We remove the cyst, try to preserve the ovary as much as possible, because the risk of removing a cyst in an endometriosis is we may reduce egg numbers. So the surgery has to be done carefully by a trained gynecologist. And also we can look at the endometriosis elsewhere outside the ovary and try to treat all of those endometriosis so that her chance to get pregnant will be better. Now we have patients where they come in with a cyst, come in with an infertility, we found a cyst, they done a cyst clearance surgery, and 3 months later they get pregnant naturally.
Okay.
Some of them even come in asking for an IVF. Now, as a doctor, we say, no, hold on first, we clear all this, and they get pregnant naturally.
Wow. Okay.
So that's is either medical treatment or they go through a laparoscopy.
Okay.
Yeah.
So both options.
Both options, depending on their situation and what we find. Yeah.
We have another live question coming in. Is endometriosis a heritable disease?
Well, so far not. The answer is no. But endometriosis tend to run in families. Now, we have not pinpointed genetic. Okay, there's no strong genetic link, but I'm sure as the research in genetics are getting better and better, and soon we will be able to find out the gene that are responsible for it.
Yeah.
But it tend to run in families, but doesn't mean your mother has endometriosis, the doctor going to have it.
Okay.
No, it's not. Yeah.
No. So there seems to be.
There seems to be a suggestion that it may be, but we can't pinpoint the exact gene yet. Yeah.
Okay.
Yeah.
Then we have another live question coming in.
Yeah.
One of our viewers is wondering. One of our viewers will have an excision done soon. Is there any tips for that before going through
the surgery? That means you're going to go through a surgery. And what are the tips before that? Well, I hope she's going through a laparoscopic surgery. Well, that depends on whether she had a previous surgery and how big is the cyst. Typically, a gynecologist will assess. And if you think that we're not expecting too difficult surgery, or even a difficult surgery nowadays can be done laparoscopically. That's the only thing that I hope she goes through that, because it benefits her in terms of a recovery. Yeah. Well, the other tips prior to surgery, nothing much. You just have to be mentally prepared for the surgery. Yeah. And typically the gynecologist will take preventive steps during the surgery so that she don't develop, or the endometriosis doesn't recur too quickly after the surgery. That typically depends on what they see during the surgery.
Okay.
Yeah.
Okay, clear answer. We've covered laparoscopy, and we've seen that laparoscopy can be a good treatment option to actually reduce endometriosis. Now, if you've had laparoscopy, can you then conceive naturally, or is there further treatment options such as IVF, which may be warranted?
Yeah. Well, that depends on, again, the severity of the endometriosis, whether the ovaries are fine, whether the tubes are affected. Now, during a laparoscopy, typically the gynecologist will first of all try to destroy the endometriosis tissues as much as possible. That means looking carefully for endometriosis elsewhere. Okay, not only at the ovary or tube, elsewhere in the pelvis. Yeah. The next thing is we'll check the tubes, whether the tubes are affected. Some of them have severe endometriosis. They have a lot of scarring that happen, and the tubes been damaged. Unfortunately, sometimes both tubes are damaged. So in that situation, I would normally reduce or destroy as much as endometriosis as possible, preserve the ovary as much as possible. If the tubes are damaged and sometimes they are swollen, we may need to remove both tubes. Then she, of course, after the recovery period, she has to go to an IVF.
Okay.
Yeah. because sometimes by leaving the tube, no, removing a tube for a woman, especially removing both tubes, it's a big thing. Once you remove the tube, you are only talking about an IVF for rest of her life to get a baby. That's a tough decision to make.
Yep.
Yeah, but if she has a damaged tube, and especially if the tubes are swollen, leaving the tube behind, right, which may affect her chances to get pregnant with an IVF later, because a swollen tube are known to reduce her chance of a pregnancy even with an IVF. So I would suggest typically remove the tube, don't leave the time bomb with her, because again an IVF doctor going to tell her you need to remove the tube. That means she's going to a laparoscopy twice.
Okay, so it's all in all, this is heavily dependent upon the person, and professional judgment is definitely warranted to see
exactly, yes.
What can be the next step to actually improve fertility.
Correct. That's why typically the surgeries are done. If their main starting issue is an infertility, typically this is done by a fertility doctor who knows what they have planned next. So it's easier to plan what kind of surgery they want to do or the extent of surgery during operation itself.
Okay, and then let's say once you've been able to actually get pregnant, does endometriosis also affect your pregnancy in certain ways?
Yes, it does. Now we used to think that endometriosis only causes difficulty in getting pregnant. Once a woman are pregnant, then she should be fine. But recently, about 2 years ago, there is some data emerging that's saying that women with endometriosis, they may have a higher risk of miscarriage. They may have a higher risk of ectopic pregnancy, meaning pregnancy that develop outside the womb. And also they have slightly higher risk of delivering baby earlier than date or preterm delivery. Yeah. Well, we'll wait for more confirmatory data on this, but so far, these are the data that we have. Yes, the answer is it also affects the pregnancy itself.
Okay, and then there's also a common conception that says, hey, pregnancy actually cures endometriosis. To what degree is this true?
Well, pregnancy doesn't cure, basically same as the medical treatment that we spoke about earlier. What pregnancy does is it suppresses the endometriosis. So she has no pain, no period, no pain. For 9 months she'll be fine. Now after the delivery, the endometriosis can come back.
Okay.
Yeah, basically it is temporarily quiet down the whole endometriosis process, but it doesn't cure it. So pregnancy doesn't cure it. Typically gynecologists used to tell patients, now for those who come in with infertility or those who have endometriosis, we'll tell them get pregnant quickly. Right? It's not that it cures the endometriosis, but you know, it leaves the endometriosis there for a long time. It may actually affect the chance or makes it difficult for her to get pregnant. So get pregnant earlier than later.
So in the end, pregnancy just suppresses the symptoms of endometriosis, but doesn't cure it.
Doesn't cure it, no.
Okay.
No.
We actually have another live question coming in. Is the chance higher if you have endometriosis and proceed to IVF without operation, and what are the risks?
All right. Now, actually, with the current data that we have, or current evidence, women with an endometriosis, they can proceed to an IVF, but it all depends at what degree endometriosis is. Now, for a woman who does not have a huge or large ovarian cyst, typically it doesn't affect the number of eggs that she's going to get in an IVF. In that situation, there is no difference if she carries on with an IVF, collect the eggs, make the embryo, or she does the operation first. No difference. Okay, we tend to do the surgery if we think that the ovarian cyst that she has going to affect her egg number. Okay, sometimes removing the endometriosis cyst, it makes the ovary to function better. Means that we may get more eggs for her, or we may get better quality eggs for her. That's why surgeries are sometimes done before an IVF. So there is no right answer for this question. It all depends on the pre-IVF assessment that she has. But typically, before putting back the embryo in an IVF, we like to reduce the severity of the endometriosis.
Okay, and is there any additional risk associated with this?
For an IVF, not really. It's just that whether we're going to get good number of eggs or not. Or sometimes the location of the cysts are also important. Located in such a way we can't access the eggs that we need to collect. Now in that situation, sometimes surgery is indicated. We need to remove the cyst, then we can access the eggs that are there.
So how about, of course, women suffer from endometriosis. Do you actually have any tips for a male whose wife has endometriosis?
Okay, all right. So my tips will be, first of all, when she complains of a period pain, don't take it lightly. Don't start telling her that that's normal. That's because you're a woman, you got a period, the pain is normal, just hold on with it for a few days. No, don't do that. Please bring her to see a gynecologist for an assessment. That's the first thing. Sometimes people used to say that the pain is in your mind. Yeah, that's a common thing when we don't know what else to say.
Yeah,
we tell that the pain is in your mind. Don't say that.
Okay.
Yeah, she's the woman with an endometriosis. The men will never understand what the period pain will be like, right? Women sometimes have a very severe pain where they just can't do a simple thing that they do daily. Okay. So that's quite severe. Yeah. So we can't only, of course we can empathize, but the thing is we need to take a step, encourage her to go and meet a doctor to get herself diagnosed. Okay. So that's what I feel the most important thing a man can do.
The most important thing.
Most important thing, yes.
To be serious, do not
and
take
be supportive.
Lightly.
Yeah, be supportive.
Be supportive.
Yes.
Okay. Do we actually have any other live questions coming in?
Yeah.
We got another live question.
Yeah, sure.
One of our viewers has a bad period pain. It went off, but now she is having difficulty to get pregnant, even with a regular period.
Yeah.
Is this because of endometriosis?
Yes, it's possible. Now, first of all, that need to know the person who asked the question. Now, she has regular period. It only means that she is ovulating every month. It doesn't tell you anything about the health of your fallopian tube, right? Of course, the second thing, it doesn't tell you about the egg numbers that you are left with. Women are born with certain number of eggs. Sometimes endometriosis may reduce the egg number. So my suggestion will be, if she has not done any tests, please go and get your tube checked. Please check your ovarian reserve, whether you can get a scan during your period or do a blood test called AMH. Now that will pick up other issues, especially with the tube. Then you know what's the next step that you can take to get pregnant. And of course, don't forget your husband. Get his sperm checked.
Get his sperm checked.
Yes, get his sperm checked. Now, endometriosis is not everything. Sometimes the issue lies with the male. Yeah.
So the importance in this case is really get yourself checked, because knowledge in this case is
important.
power.
Getting information early, that's the key. That's the key in getting pregnant with endometriosis.
Okay. Yeah. Okay. Another question coming in. Can endometriosis be diagnosed via TVS or any other option apart from laparoscopy?
Yeah. Well, if the woman has a cyst, and the cyst, now when you do a scan, we look at the cyst, we can look at the character of the cyst, we can more or less know that this is endometriosis related. Then the diagnosis can be done. Now, if the woman has no cyst at all, she only presents with pain symptom, we suspect that she has endometriosis. More likely than not, she has endometriosis, but we can't, no way to confirm it.
Okay.
The only way to confirm is by direct visualization through a laparoscopy. Yeah.
Okay, so direct laparoscopy is necessary.
Yeah, it's necessary sometimes. Yeah.
Okay. Another question coming in. Will the medication taken during IVF, will that worsen the endometriosis?
Okay. Now, women who take medication during an IVF, now IVF is a very short process. She may need medication for about 8, 9, 10 days. It's a very short term. And all these medications are short-lasting medications. That's why the woman needs to take it daily, right? Yeah. So if you ask me, maybe the endometriosis can get flared up slightly because we increases the estrogen level during that period of time. Maybe let's say between 10 to 2 weeks. And after that, it should suppress.
Okay.
Yeah, there is no long-term effect where by taking IVF medications, it's going to really worsen the endometriosis for the next few months. No, it really doesn't do that.
So the effects of IVF medication
is very temporary and probably is very minimal.
Okay.
Yeah.
Okay. Well, thank you for that, doctor. I'd like to thank you very much for answering all of the questions from our dearest viewers.
Yeah, thank you for the questions. Yeah, very interesting questions. Yeah.
We've now actually reached the end of this Facebook Live session. Very interesting. And I do hope everyone has been able to learn something new today. Before we leave, I'd just like to remind our viewers that should you have any suggestions for topics to be covered during next Facebook Live sessions, please shoot us a message to our Facebook page, KL Fertility Center.
Yeah. Okay.
With that having said, Dr. Agilan, I'd like to thank you again very much for your time, effort, and of course your expertise. And
thank
also
you.
Thank you to our
Mary.
dearest viewers
Thank you for the
for
viewers.
watching.
Thanks for
See you
watching.
next time.
See you next time.